Other clinical signs other than skin and gastrointestinal signs, and don't forget lymphocytic plasmacytic stomatitis in cats. That could also be a sign of food allergy as well. But when we start to look at other clinical signs, basically we start to think about neurologic signs, so dominance, aggression, behavioral diseases, seizures, idiopathic seizures. Who's the most common breed that we see associated with idiopathic seizures? It's basically the chocolate Labrador. Who's my number one breed associated with food allergies? Chocolate Labradors. And so when we start to see seizures, and it's called idiopathic because we don't know what the underlying cause is, think about food allergy. Especially, you don't want to condemn a dog that's a year of age to a lifelong course of anti-seizure medications, phenobarbital, that have a lot of adverse reactions associated with it. Other clinical signs that we can see associated with food allergy is chronic recurrent urinary tract infections, because we get perianal or perivulvar inflammation, and that inflammation can result in an ascending infection and resulting in chronic recurrent bladder infections as well. So that's something to kind of keep an eye on, make sure that we don't look for it as an underlying cause anyway. The cats with feline asthma, again, the last thing that I want to have to do is puff a cat on a regular basis, because you're not always going to be there for that cat. So if we can find an underlying etiology such as food allergy, that would actually be a much better solution than having to puff a cat on a regular basis. The other couple of signs that we see, skin signs, symmetric lupoid onychodystrophy. That's where basically all the nails are sloughing off in a pet, and that's where we can actually see food as an underlying cause. We also look at things like hypothyroidism, infectious diseases, but definitely think about food allergy. And the reason for that is most likely with the food allergy, they've got an inflammatory component associated with it that's resulting in a decrease in the absorption of the essential fatty acids. And in this case, it's actually omega-6 fatty acids that they're having a problem absorbing. And so then what happens is their nails start to slough off, and they actually can be almost orthopedic in nature as far as their presentation, to the point where they feel like they've broken a toe or they've broken something along the limb, when in fact actually it's the nail that's sloughing off and pushing back into the quick and kind of injuring that nerve, and so the pet is very sensitive to that. We start to see immune-mediated diseases like pemphigus foliaceus that can be actually food triggered as well. So I've documented several cases where they've been very early onset, less than a year of age. We think about what can trigger this immune-mediated attack on the skin. Definitely food allergy is one of them that can do that as well. Two other diseases that are associated with food allergy when we start to look at the skin include acrylic dermatoses and Penile Vasculitis. Acrylic dermatoses basically is a condition, acral meaning distal extremity, licking, obviously licking themselves, and dermatoses are granuloma, forming a very thick lesion where they're focused on licking at that lesion, and by licking at that lesion, it also stimulates endorphin release for the dogs. And so with that endorphin release, it's just this beautiful vicious cycle that gets started, and usually it's triggered by food allergy. Food allergy causing a lot of licking, so they go ahead and lick at themselves. Often they'll have secondary infections, either bacterial, yeast, maybe even sometimes Demodex might come up in those areas, and then with that licking and ongoing irritation, they get that endorphin release from the soothing effect that they get from the licking. Penile vasculitis is a condition that's called a type 3 hypersensitivity, and that's where an antigen, the food, plus an antibody that the patient forms to that food will actually circulate around and find itself lodged in distal extremities. So the pinna, or the ear flaps, are definitely the big focus spot that we'll see associated with that. Sometimes it ends up at the tail as well. But what you'll see is basically you walk into your house and it's almost like a crime scene where basically blood is splattered all over the wall from the pet shaking its head, and then because of the necrosis that occurs at these distal extremities, and that's from all this antigen antibody complex forming and poking holes in the blood vessels in the ears. And by doing that, then it creates necrosis or dying of the skin cells, and then we get blood leaking out, and then the blood basically starts to spatter all over the place. So if you have acrylic dermatoses, a very chronic disease, what's chronic and what's stimulating that chronicity? The food that you're feeding them on a regular basis that they're allergic to. Penile vasculitis causing a type 3 hypersensitivity or an immune-mediated response. Think about working on a dietary restriction to resolve these problems. So when we start to look at food allergies, and it's very all-encompassing. You definitely are what you eat, and what you eat can actually cause adverse reactions as well. So you want to make sure that you end up on a good diet that doesn't tend to cause any adverse reactions for your pet.